Yes, hi, I'm Martin Kinney from Cambridge in the Waikato of New Zealand. A random search on a Sunday morning back in New Zealand, trying to find options to have my hip replaced. I wasn't satisfied with the results I was going to get in New Zealand as far as time frame was concerned, and I randomly Googled IndiCure, and that was one of the best Google searches I've done. My experience with IndiCure has been nothing but exceptional. I know I was asking lots of probing questions. It's a big deal to, like, why would I travel from New Zealand to India to have my hip replaced? But they just answered all my questions and put me at ease. Included in this was a one-on-one interview with my surgeon, Dr. Mudit Khanna. I can't recommend him high enough. It was a really laid-back, relaxed interview. He'd just come off the tennis court. It was exactly what I wanted. He put me right at ease straight away, just create that little micro relationship, which meant a lot. So then into the hospital and for the surgery, the care in Waikato Hospital was second to none. I've never been in a hospital before since the day I was born, so there's a lot of the unknowns from my part, but the care was exceptional, right, and the dedication that was pointed all at me and my welfare, which was a little bit overwhelming if anything, but I just took it because I was in a vulnerable state. I guess you could call crazy thing, but as soon as I started communicating with IndiCure, all of a sudden international people going internationally for surgery became prevalent on the New Zealand media, and I was actually saying, keep it quiet, keep it quiet. India will realise this and put their prices up. But once again, I guess that just added to my confidence that I'd made the right decision, really. But I do know now, I've just read in the media lately, that it is really high in New Zealand media, the concern about the number of people leaving New Zealand to have treatment like mine done. And they're trying to paint a negative on it, that there's no safety net with insurance and so forth if something does go wrong. The main reason I came to India is based on the unfortunate situation with the New Zealand health system. I don't have private insurance, so I would have to, I could have gone and had the operation done privately. It would have come at quite an expense. So the alternative to that was waiting out on the wait list within the New Zealand system, and that was going to be between 6 and 12 months. So I've already been debilitated through this hip joint for around 18 months, and I work in a professional job. It's a high-powered job. There's a lot of stress involved, and I couldn't handle waiting that extra amount of time. Obviously, I did a lot of research. There's especially risk management. No one's going to insure me to come here to have this operation done, so that was my biggest fear. And that's where I got a lot of confidence in my decision from that one-on-one meeting with Dr. Khanna. He reassured me that I was making the right decision, and the micro percentage chance of something going wrong was exactly that, a micro percentage. So I left New Zealand and I took it on as an adventure, but I was 100% confident that I was going to have a positive outcome. This was one of the positives of coming to India, was the method of the surgery was not available in New Zealand, going through the interior, through the front of my into my hip, which meant there was no damage done to the muscles and so forth, so the recovery's a lot faster. The type of joint that I got put in, once again, is not available in New Zealand. It means I've got 99% chance I will not have a dislocation, which is a vulnerability when you do have a hip replaced, which means a lot as well. But yes, the care and dedication and the open communication from IndiCure and all the staff was exceptional. I guess in closing, if anyone in New Zealand was considering coming to India and looking for whether it's a knee or a hip, I can't speak for anything else, but at least for a hip, I highly recommend you connect with IndiCure, and you can trust them